Welcome back to another episode of Cape Ann Today. Today, Kory and I are talking to Rachel Belisle-Toler, who is the Assistant Public Health Director. Max Schenk has stepped back for a little bit, and they are looking for a new Public Health Director, and Rachel is with us in that time. And Kate Cunningham, who is the new Public Health Nurse in the City of Gloucester. Hi, you guys.
Hello, thanks for speaking with us today.
And did I get that right? Your names, your titles? We all good?
Yes.
Okay. All right. So, Rachel, let's start with you first. You have done a lot of work in the city on the Good Harbor Creek. Tell us what you're learning about the situation there.
Well, we're learning quite a lot. Unfortunately, right now, we're in a bit of a waiting game because we need one more round of wet weather sampling to really determine, have the final evidence that we need to say this is exactly what the pollution source is.
We all need wet weather sampling. I think right now that we all need that.
Right, we definitely do. I apologize. I'm so sorry. Let me put that on. Sorry about that.
That's fine, Rachel.
So wet weather sampling, we need a heavy short duration rain event in order to understand how the ecosystem of the creek behaves in wet weather. So because we have had quite a bit of dry weather, we're in drought conditions right now, we're just sort of crossing our fingers and hoping that that things change in terms of the weather. But we are very much closing in, I would say, on the source. It's been about 14 months of investigation at this point. We've done hundreds and hundreds of samples. We've been out there, sampling all sorts of the marsh ecosystem in all different places. We've ruled out a lot of things. We've honed in on different areas. But we are keeping the creek closed right now, of course, until I can say that we're absolutely sure we've identified the source of pollution. And also, we want to make sure that it's remediated and safe to swim in before we reopen it.
Has it been a particularly bad year for the creek? The levels have been astronomically high, or?
It's been, so we had a sampling event on June 9th of 2021, where we started to see repeatedly high levels of enterococci in the creek. The safe limit of enterococci, because there does always exist a little bit of bacteria in bathing waters, is 104 colony forming units. And starting last year, we were seeing results into the thousands. So we knew something else was going on. Something happened that was different. Now, the Good Harbor Creek is really interesting because it's a complicated, unique ecosystem. We see a little bit more proliferation of bacteria there for two main reasons. First being water circulation is really low there. It's a relatively low flow area. It doesn't get a lot of wave activity, meaning that the bacteria doesn't break down as easily. And number two, it's our warmest bathing area. It's our warmest beach area. The water temperatures are really high, which bacteria really love. So it's typical for that to grow quite easily there. So that's why we do see, over the years, we have seen other bacterial issues. However, this is certainly the highest we've seen in recorded history. And this is not a normal fluctuation of the ecosystem. This is something else, and this has been ongoing since last June.
Interesting.
So, but it sounds like we are sort of maybe pointing at heavy rain events being one of the primary sources.
It's possible that heavy rain events trigger other pieces of the puzzle. And I wouldn't feel comfortable speculating on exactly what it is at this point, because we want to make sure we have all of the data we possibly can to say for sure this is it. But heavy rain events could potentially catalyze other events in the ecosystem. So it might not be the rain itself necessarily, but it could indicate other conditions for the ecosystem.
Well, since we have both of you here, we would be remiss if we didn't talk about COVID and the pandemic. Now, Kate, you have done a lot of work in policy on during the pandemic. Do you want to introduce us to the work you've done and tell us how that went? Because you were part of the whole gig, right?
I was definitely involved in bits and pieces of lots of different parts of the COVID-19 response. When it started, I actually had a fellowship with the federal government with the Office of Emergency Medical Services. And as you know, our emergency medical service people were right in the thick of things right at the beginning, and did not have proper PPE right away. So there was a lot of policy discussing appropriate PPE and how we can best protect the people on the front lines. And then the second year of the pandemic, I was with the Office of Global Affairs and the Pandemics and Emerging Threats team. So that was more of the global aspect of things, working with the World Health Organization about, okay, what have we learned from this? How can we move forward? How can we handle the current pandemic and make sure that we're getting vaccines out equitably? All of that kind of coming together. So I worked some on the domestic side and then some on the global side.
Do we have an idea of where the city is at now as far as dealing with COVID? I mean, I guess one saving grace is that the school isn't back in session for the most part. I know you work closely with Superintendent Lummis there, but where exactly does Gloucester stand now?
It's an interesting situation that we're in because we do have reasonably high vaccination rates, which has been grateful and wonderful. However, everybody's getting COVID this summer. We're not seeing the hospitalizations that we were seeing, and we're not seeing the deaths, which is fantabulous. But everyone is still getting COVID. It's still circulating. So that means that the vaccines are working, but it means that we still need to be careful because you still have older folks, immunocompromised folks, the very young who can't get vaccinated yet or who have not been fully vaccinated yet, who are still at risk. So while those of us who are reasonably healthy and who are vaccinated can probably get COVID and be all right, we still have to be very considerate of the vulnerable members of our communities and, maybe mask up when we're going to meet those people or, not visit as much or just be careful, wash your hands more. I would absolutely recommend that anybody who's eligible for a booster do get boosted. That will help a lot with that current circulation. There are some rumors that Moderna and Pfizer are both working on a variant specific booster, but those will not be ready until later in the fall. So if you're eligible for a booster now, get your booster now, and then come the fall, you'll be able to get another one, which is variant specific. And in that meantime, you'll have the protection that you need, because once we start coming back indoors again, that risk of spread goes up.
Right. So it is really true that people are not getting as sick in the city from COVID. So does it point to the success of the boosters and the vaccines, or does it by any chance point to the fact that the variants might be less powerful?
I wouldn't say that the variants are less powerful, because in unvaccinated people, we're still seeing that amount of sickness. Yeah. People are getting less sick. I will also say Paxlovid, a lot of folks are getting Paxlovid, and that's been helpful for a lot of folks as well. Yeah. So I really think it's the combination of the medications and the vaccinations that are lessening the effect that it is having on an individual person. Mm-hmm. It's the current variants that are circulating are more infectious, but not necessarily more deadly than, say, Delta was.
Okay. Yeah. And Rachel, what are you seeing or what are you thinking about in terms of policy? And I'm not sure if you will be in charge of this as the Assistant Director of Public Health in the city going into the fall, and we're worrying about cooler temperatures. Is there any policy change on the horizon in terms of masking?
We are staying vigilant, keeping an eye on the numbers. The board is staying vigilant. Ultimately, we send out weekly updates to the board on the numbers, the vaccination rates, the wastewater numbers, and the board will be making decisions as appropriate if there needs to be a policy change. Now, that's not a current discussion, but again, things can change rapidly with COVID, and we are ready to respond appropriately if that does happen. So it won't be my decision, but Kate and I will be in the wings ready to inform and support the board if the time comes.
Yeah. And I was going to ask, how helpful has it been monitoring the wastewater? Are you still heavily relying on that as sort of your main metric?
Yeah, I would say that it's been a very important piece of the puzzle in terms of understanding the state of COVID. Obviously, there's a bit of delay in understanding cases. There's also the nature of what actually gets reported. There's lots of undiagnosed cases of COVID going around. And Kate could probably speak more to this, but having the wastewater, having this different angle of data to help us understand where the city is at, has been very helpful and interesting. And I would say generally mirrors what we're seeing with the other numbers, but it's important to have both sets of data to sort of confirm that trend.
Mm.
Yeah, particularly since there's all this undiagnosed. Wait, did I interrupt you, Kate? I'm sorry.
Go ahead.
Well, I was just going to follow up on the, everyone's just doing a home test and then saying, oh, I'm sick, stay home. So what are we doing about that? Keeping track of the numbers.
That is the difficulty with the home test, because I mean, the numbers that I get are those people who felt that they needed to go get a PCR test, which is the one that, takes 2 days to come back. And those are either people who feel sick enough that they feel like they need one, or they just want to already confirm their home test. So it's not necessarily an accurate example of how much COVID is circulating, whereas the wastewater is a better metric. So we can kind of compare those two numbers and say, okay, well, who's feeling that they need to go get a PCR test versus how much is actually circulating, which continues to suggest that with the vaccines and with as much as circulating, we're handling it better than we would have last year,
Right. Yeah, that's really interesting. So what are the wastewater numbers right now?
I believe Rachel has those.
Yeah, you're both looking at your computers. You get these reports. Yeah.
I don't have the exact numbers, but we do continue to see a downward trend. Of course, it goes up and down a little bit, but we're seeing in general a downward trend. But Kate has been reminding us repeatedly that it's still important to take the necessary precautions, because the folks that are getting sick are often immunocompromised, and we want to make sure we protect that part of our population.
I wanted to ask sort of a random question here to both of you. Has the oppressive heat, how are folks dealing with that? How is the city dealing with that? We also know we're in the midst of a water ban as well. But between obviously the large fires around Rockport and Gloucester and the heat, what sort of issues have you been dealing with?
That's a great question. I would say that the health department has only been sort of tangentially involved with heat response. Certainly we're keeping an eye on things and offering support to our colleagues throughout the city when necessary. There are cooling shelters around town, depending on the level of temperature. And we are, again, trying to offer support with the water ban. But we've only been sort of tangentially involved, I would say, in heat response.
So no reports of people actually getting ill or not having enough sort of ventilate, air in their apartments. All I can think of is everyone always refers to Chicago in 1993, I think. So, no one wants to live in that city again.
Well, it's pretty amazing. If the wind was it shifted in a different direction in the last couple of weeks, how much people would have been inhaling smoke. I mean, it's amazing. I'm over in East Gloucester. We've only had like a touch, like maybe 3 or 4 minutes a couple of days ago. Whereas, folks over on like Wheeler Street by Poles Hill, and of course, Rockport is dealing with us ad infinitum. So lucky in that regard.
Yeah. So what else is on your subject list these days to be concerned about? Any other concerns in the city?
Well, as it regards to heat, just a reminder for everyone to stay hydrated, especially like even if you don't think you're thirsty, just a little bit extra. It's always a good plan. Sunscreen, very important. Don't hang out in the sun for long periods of time, things like that.
Exactly.
Other than that, the only other thing that I would be keeping an eye on right at the moment, we're planning for flu season. Again, once we all get back indoors, those respiratory viruses are going to start circulating again. So we are planning for flu season. We're planning on flu vaccinations. So keep an eye out for those. And then other than that, we're keeping an eye on monkeypox. Knock on wood, so far we've been okay, but they are seeing increasing numbers in the United States. There's still a limited supply of vaccine that is kind of being closely guarded at the moment. So we're just keeping an eye on that situation as to when vaccines increase in supply and are more diversely available, and hoping that can stay under control.
And are you in touch with your global and national policymakers about so any sort of inside baseball from those teams that you're hearing?
Not at the moment. I do have a meeting actually with some old fellows next week, so we'll see if I can learn anything interesting.
Okay. Well, we'll definitely talk about monkeypox next time we all get together. So, well, Rachel, any last words from you, except maybe an ice cream cone recommendation?
I would say that we're probably more qualified to give pizza recommendations at this point, because we do
Sure.
have a couple new employees in the office that are not from Gloucester. And so we've been trying to make our way around with pizza, but maybe next time I'll have to put some more thought into the ice cream cone recommendation.
Yeah, the pizza is it the sweet sauce or not? That's the starting point for people.
I have particularly high pizza standards, so I think I may not be the person to ask about that. I would say no to the sweet sauce.
Me too. I'm with you, Rachel.
Yeah, right. So I guess last thoughts is that obviously Max left some big shoes to fill. We're hiring for a couple different positions, particularly in our prevention team, where we focus on substance use prevention. And we have several new employees. Obviously, we have Kate here, who started at the beginning of the summer, Bree Gray and Jake Taylor, who are our new health inspectors. We're building this really incredible team, working very, very hard, and trying to make the city proud in the health department. So that's exciting. And we've been doing lots of exciting things. We're working on strategic planning for the fall with the department, just making sure that we're approaching public health in the most effective way, and representing the city the best we can.
Well said. Kate, how's the transition been so far? And what are you learning about Gloucester in the area?
So I came to Gloucester and then almost immediately went to Fiesta. So I feel like I've absorbed a lot in a very short
It's baptism by fire right there. Yep.
Yeah.
Baptism by Fiesta.
You know everything then.
Yeah.
It's been great so far. I'm loving the area. I'm loving the people. Everyone has been very nice to me so far. I hope that continues.
And do you have strong feelings about pizza yet or not?
I'm reserving judgment until I have tried all the pizza. I actually like both sweet sauce and regular sauce. But I'm a little bit picky just about my seasonings. So we'll see.
You don't like dried oregano, or you are okay with that?
I mean, dried oregano isn't as good as fresh oregano.
Well, and all this conversation, we have to tell you, comes from an email from Max Schenk, who was encouraging, ice cream cones as medicine. So, so that's where this started. So Max has left some serious issues, including this one. Yeah. Yeah. And he and I have had some long conversations about the mosquito spraying, which we will save until next spring.
Yes, absolutely. Yeah. There's still enough summer left for us to do some more ice cream investigation.
Yeah, we'll have to continue the conversation. Yeah.
Absolutely.
Well, thank you so much for all you do and for talking to us today.
Of course. Thank you for having us.
Yeah, I appreciate your time.
Yeah, thanks.
Interested in a sponsorship? Email sponsor@1623studios.org to learn more.